Hello, thank you for joining me today to discuss DANYELZA or naxitamab and its role for treating relapsed or refractory high-risk neuroblastoma in the bone or bone marrow. My name's Dr. Leonora Slatnick and I've been working in oncology for 5 years. Before we begin, I would like to disclose that I work with Y-mAbs. Additionally, the information presented today is for educational and informational purposes and is not to be viewed as medical or specific treatment advice. Let's get started. Here's what we'll be running through today. We'll start with a quick overview of high-risk neuroblastoma, then we'll explore what DANYELZA is and how it works. We'll also review some clinical trial results and discuss how a DANYELZA treatment cycle works and what to expect at each step of the process. We'll also discuss important safety information, including the boxed warning. At the end, we'll summarize everything with a quick summary of everything we've covered. So, if you're ready, let's take the first step on this journey together. Let's start by delving into neuroblastoma and what makes it high risk in some patients. Knowing more about the condition is the first step towards understanding treatment and prognosis. High-risk neuroblastoma is a particularly challenging form of cancer that often affects children. It can be found along the sympathetic nerve chain in other areas of the body and can often spread to the bone or bone marrow. High-risk neuroblastoma is characterized by its aggressive nature and poor prognosis, frequently requiring intensive treatment approaches. There are several factors that can make it particularly challenging. First, the age at diagnosis plays a crucial role. If someone is diagnosed after they're 18 months old, the cancer is often more advanced and difficult to treat. Histology also provides important insights. This involves examining the cancer cells under a microscope. If the cells look very abnormal, it usually means that the cancer is more aggressive and can contribute to poor prognosis. Another key factor is high amounts of the MYC-N gene, which, when amplified, makes cancer cells grow faster and become more aggressive, complicating the treatment process. Other biologic features of the tumor cell are important as well. Finally, if the neuroblastoma is at an advanced stage, meaning it has spread to other parts of the body, like the bones or bone marrow, it becomes even more complex to manage. These elements combine to make high-risk neuroblastoma a tough opponent. However, treatment advances in medical therapies have improved outcomes. Your child's Curie score is calculated using results from an MIBG scan. This score shows how much neuroblastoma is in the body and how widespread the disease is. The score can range from 0 to 30. To calculate a Curie score, the body is divided into 9 skeletal sections and 1 soft tissue section. Each section measures MIBG activity on a scale from 0 to 3, and the total Curie score is the sum of all 10 sections. Comparing Curie scores before, during, and after treatment helps doctors understand how well treatment is working. About 1 in 2 children who are diagnosed with neuroblastoma have high-risk disease. As we've discussed, high risk means cancer has often spread to critical areas like the bones or bone marrow. One of the goals of treatment is to reduce cancer levels in these areas. Responses to treatment can vary. They range from complete responses where no disease is detected to various forms of incomplete responses and progressive disease. These incomplete responses can include stable disease where the cancer has not changed, partial responses where the cancer has reduced in all areas but has not completely disappeared, and minor responses where the cancer is reduced in some areas but not all. Progressive disease is where the level of detectable disease is increasing in any or all of the following areas: the primary tumor site, the bones, soft tissue, and/or the bone marrow, or if there are new sites of disease detected. If your child has had an incomplete response to induction therapy, which is the initial attempt to treat the cancer that often includes chemotherapy and surgery, or relapse therapy, then this is an important moment to decide on the next steps. Your healthcare team will be there to guide you through all the treatment options available to your child. Think of it as a journey where one of our goals is to gain as much ground as possible against the cancer. If your child doesn't fully respond to induction therapy or relapse therapy, there may still be neuroblastoma in the bones or bone marrow. It's important to understand what to watch for, where to look, and when it might be time to adjust your child's treatment plan. Next, let's talk about DANYELZA and how it can potentially make a difference in this battle against high-risk neuroblastoma. DANYELZA is the only FDA-approved immunotherapy treatment specifically for relapsed or refractory high-risk neuroblastoma in the bone or bone marrow in patients who have shown a partial response, minor response, or have stable disease in response to prior therapy. DANYELZA can be used to help remove remaining cancer cells in the bone and/or the bone marrow after earlier treatments. It's the first and only FDA-approved humanized GD2 binding monoclonal antibody available. Now, you might be wondering, what does humanized mean? Essentially, it means that DANYELZA is designed to closely resemble natural human antibodies. This may help reduce the likelihood of an immune reaction against it. DANYELZA is used in combination with another agent called GM-CSF, which stands for granulocyte macrophage colony stimulating factor. GM-CSF helps stimulate the immune system. DANYELZA and GM-CSF are used together to specifically target high-risk neuroblastoma in the bone or bone marrow in patients who haven't fully responded to initial therapies or who have experienced a relapse. Select important safety information for DANYELZA. What is the most important information I should know about DANYELZA? DANYELZA may cause serious side effects, including serious infusion-related reactions. DANYELZA can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with DANYELZA. Tell your healthcare provider right away if you get signs or symptoms during or after your DANYELZA infusion. Nervous system problems. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems, including severe pain from nerves or neuropathic pain. This includes pain in the abdomen, bones, neck, legs, or arms. Pain is common with DANYELZA and can be severe. Inflammation of the spinal cord. Signs or symptoms may include weakness in your legs or arms, bladder and bowel problems, pain in the back, legs, or stomach, numbness, tingling, or a burning sensation. Please stay tuned for additional important safety information at the end of this video. To understand how DANYELZA works, we need to talk about GD2. GD2 is a type of molecule called a glycosphingolipid and is found on the surface of cells such as neurons and peripheral nerves. In normal cells, it contributes to cellular communication and signaling. GD2 is overexpressed on the surface of certain cancer cells, such as neuroblastoma cells, making it a key target for therapies like DANYELZA. By binding to the GD2 on the surface of neuroblastoma cells, DANYELZA can direct the immune cells to recognize and destroy tumor cells. The way DANYELZA works by binding to GD2 means it supports the immune system's defense against high-risk neuroblastoma, as there may still be cancer cells in the bone or bone marrow after initial or relapse therapy. So how does this process work? The binding of DANYELZA to the GD2 flags the cancer cells for destruction by the immune system using two different approaches. The first approach is a complement-dependent cytotoxicity, where immune cells mark harmful cells for death. And the second is through antibody-dependent cell-mediated cytotoxicity, where immune cells directly destroy marked cells. Think of DANYELZA as equipping the immune system with a high-precision targeting system. It's worth noting, however, that because GD2 is also found on healthy cells, like nerve cells, DANYELZA can cause side effects such as severe pain. Despite these challenges, the precise targeting and immune response it triggers offer a potential avenue for treatment. Now, let's take a look at the clinical data that supports using DANYELZA for appropriate patients with high-risk neuroblastoma who haven't had a complete response to induction or relapse therapy. DANYELZA has results in two key clinical trials known as Study 201 and Study 12-230. These led to its accelerated approval by the FDA for treating relapsed or refractory high-risk neuroblastoma in the bone or bone marrow. In both Study 201 and Study 12-230, more than 1 in 3 patients responded to treatment, and more than 1 in 4 had a complete response. Let's take a closer look at Study 201, an ongoing Phase 2 open-label global single-arm multi-center trial. All participants know that they are receiving DANYELZA, which makes it open label. The study is single arm, meaning there's no comparison to another treatment. This type of study is called open label, meaning there's no placebo or alternate treatment being used. In Study 201, Y-mAbs is assessing the efficacy of DANYELZA in combination with GM-CSF in 22 children with high-risk neuroblastoma who had an incomplete response to induction or relapse therapy and still had disease in the bones and or the bone marrow at the start of treatment. Responses were confirmed by at least one follow-up scan for each child. It is important to note that this study does not include patients with actively progressing disease. That means it excludes patients whose cancer is rapidly getting worse at the time of joining the study. Instead, the study focuses on those whose cancer has been at least stabilized by prior therapy, but the cancer still remains. The primary goal of this study is to assess the overall response rate, known by the acronym ORR, to the treatment with DANYELZA and GM-CSF. The secondary goals of the study are to assess the duration of response, the complete response rate, and also the safety. So far, 22 patients have been evaluated for the effectiveness of DANYELZA. This evaluation involves monitoring how well the cancer responds to the treatment and observing any side effects. In Study 201, the overall response rate to date is 45%, meaning 45% of patients experienced at least a partial response to treatment. To break this down further, 36% of patients had a complete response, meaning no detectable cancer was left, and 9% had a partial response, meaning their cancer shrank but did not completely disappear. Additionally, the duration of response indicates how long the response lasted. In this study, 30% of patients maintained their response for at least 6 months, with the median duration of response being 6.2 months. After approval, Study 201 continued to enroll patients, and a recent analysis looked at the response of 52 children. In this analysis, 40% of patients showed an overall response, with 29% achieving a complete response and 11% having a partial response. All 15 children who had a complete response had a Curie score of 0. The additional analysis looked at 2 groups of children treated with DANYELZA plus GM-CSF. The first group, shown here in the gray box, were those with refractory disease, meaning they had an incomplete response to induction therapy, or those who had relapsed disease after having an initial response. The second group, shown in the green box, were those with an incomplete response after relapse therapy. Additionally, Study 201 also looked at data from children who had or had not received previous treatment with anti-GD2 medicines. In addition, the analysis collected data for children who had developed anti-drug antibodies during treatment with DANYELZA. In the gray box, 31% of children who had previously received anti-GD2 therapy had an overall response. In the green box, the overall response rate was 44% in children who had not previously received anti-GD2 therapy. 22% of children who had developed anti-drug antibodies while on treatment with DANYELZA responded to DANYELZA. Both Study 201 and Study 12230 focused on patients with high-risk neuroblastoma who had an incomplete response to induction or relapse therapy and still had disease in the bones and or the bone marrow at the start of each study. Responses were confirmed by at least one follow-up scan in both studies. The other clinical trial, Study 12230, was a combined Phase 1 and 2 open-label, single-arm, and single-center trial with 72 patients enrolled. However, the efficacy analysis included only 38 patients who had evaluable disease at the start of the study. Just like in Study 201, the primary goal of Study 12230 was to assess the overall response rate to treatment with DANYELZA and GM-CSF. The secondary goals of the study were to assess the duration of response, complete response rate, and also the safety. The overall response rate in Study 12230 was 34%. This means that 34% of patients experienced at least a partial response to treatment. Specifically, 26% of patients had a complete response with no detectable cancer, and 8% had a partial response, where their cancer shrank but didn't disappear entirely. 23% of patients maintained their response for at least 6 months. Now, let's talk about the potential side effects of DANYELZA. Throughout the treatment, your healthcare team will closely monitor your child and have a plan in place to manage any side effects they might experience. Each patient is different and may experience some but not all of the common side effects, including reactions during the infusion and severe neuropathic pain, which can affect areas such as the abdomen, bones, neck, legs, or arms. To help manage these side effects, healthcare providers will give medications before and during the DANYELZA infusion. These medications are designed to reduce pain, prevent infusion-related reactions, and control nausea or vomiting. Additionally, the infusion rate might be adjusted, paused, or even stopped if necessary, depending on the side effects. After each infusion, your child will be monitored for at least 2 hours in a setting with emergency equipment and medications to ensure immediate care if needed. In clinical trials, most patients were given DANYELZA in an outpatient setting, and many children were able to go home the same day. There are 2 critical safety aspects to be aware of when using DANYELZA. These are potential serious infusion-related reactions and neurotoxicity. First, let's talk about serious infusion-related reactions. These can include severe conditions such as cardiac arrest, anaphylaxis, which is a severe allergic reaction, low blood pressure, sometimes called hypotension, bronchospasm, which is the tightening of the muscles around the airways, and stridor, which is a high-pitched wheezing sound caused by disrupted airflow. Signs and symptoms to look out for of infusion-related reactions during or after DANYELZA treatment include swelling of the face, eyes, lips, mouth, or tongue, itching, redness of the face, skin rash or hives, trouble breathing, coughing or wheezing, noisy high-pitched breathing, or feeling faint or dizzy. DANYELZA can also cause fever, nausea, or vomiting during or after the infusion. Speak to your child's care team as soon as you notice any of these signs or symptoms. To help prepare for the infusion and decrease the risk for infusion-related side effects occurring, your child's care team may give medications such as steroids, antihistamines, fever reducers, or medicines for nausea and vomiting. Your child will be given these before the infusion as recommended by their healthcare team and will continue to be monitored for at least 2 hours after the infusion is completed. If a serious reaction occurs, the care team is prepared to reduce the infusion rate, interrupt it, or even stop it altogether based on the severity of the reaction. This proactive approach helps manage potential complications. The second safety aspect to be aware of is neurotoxicity, which refers to damage to the nervous system. This can include severe nerve-related pain. It can also include conditions like transverse myelitis, which is inflammation of both sides of one section of the spinal cord, and posterior reversible encephalopathy syndrome, or PRES, which can cause headaches, seizures, and changes in vision. To manage neurotoxicity risk, pre-medication for neuropathic pain is recommended. There are different types of pain medication that can be given, each needing to be taken at different times prior to or during the infusion. Please be sure to reach out to your healthcare team if your child experiences new or worsening symptoms. We can now explore what the treatment journey with DANYELZA looks like for you and your child. Understanding this process can help you both feel more prepared and confident. Everyone is unique, and the number of treatment cycles with DANYELZA depends on how each child responds to treatment. Typically, treatment is given in 28-day cycles on days 1, 3, and 5. If your child shows a complete or partial response, they will continue for 5 more cycles. After that, additional cycles may be given every 8 weeks as determined by your healthcare team. Monitoring your child's blood pressure for the first 8 days of each treatment cycle is crucial to ensure their safety. Throughout treatment, your care team will assess your child's response to DANYELZA and decide if treatment should continue. Treatment can continue if there is a response to treatment and the side effects continue to be tolerable. DANYELZA is given through an intravenous infusion. This means the medication is delivered directly into the bloodstream through a vein. The dose is based on your child's weight and is administered on days 1, 3, and 5 of each 28-day treatment cycle. Each infusion is combined with GM-CSF, the medication that helps boost the immune system. GM-CSF is given 10 days total, 5 days prior to treatment and on days 1 through 5 of the treatment cycle. These cycles are repeated every 4 weeks until your child has a complete or a partial response. Once we see either response, 5 additional cycles of DANYELZA are given. And if needed, further cycles can be given every 8 weeks as determined by your child's care team. Let's take a closer look at what to expect at each stage in this process. Before the first infusion, there are a few important steps to ensure that your child is ready. GM-CSF that is used with DANYELZA can be given at home. This is given as a small injection under the skin, started 5 days before the first infusion, with the dose increasing on the day of the first infusion. Additionally, preventative pain medicine like gabapentin may also be given at home. This helps manage nerve pain during treatment. During infusion days, here's what to expect. On day 1, the first DANYELZA infusion will last about 60 minutes, with subsequent infusions on days 3 and 5 taking 30 to 60 minutes, depending on how well your child tolerates it. Your child will be monitored for at least 2 hours after each infusion to ensure their safety. Your healthcare team is prepared to manage any serious infusion reactions. Your child's doctor will decide whether or not your child needs to stay overnight in the hospital. After each infusion day, it's important to continue monitoring your child's blood pressure for at least 8 days after the first infusion of each treatment cycle. If your child responds well to the initial treatment, DANYELZA will be given for 5 more 28-day cycles. After that, treatment may continue every 8 weeks if needed. Your child's doctor will regularly monitor their response to determine if treatment should continue. Treatment will be stopped if the disease progresses or if side effects become too difficult to manage. Other support is also available. Y-mAbs Connect is DANYELZA's patient support program. It provides information about access, insurance, potential financial support, and other resources for qualified patients. The dedicated team of Y-mAbs case managers may help you understand your child's insurance benefits, provide information about third-party organizations for travel and lodging support, and determine eligibility for financial support programs. For eligible individuals with commercial or private insurance, the Y-mAbs Connect copay program can help reduce out-of-pocket costs. For those uninsured or underinsured, the Y-mAbs Connect Patient Assistance Program may provide DANYELZA at no cost. You're not alone in this journey. Your child's healthcare team and Y-mAbs Therapeutics are here to support you every step of the way. Let's review what we've been through today. High-risk neuroblastoma is a serious and aggressive cancer that primarily affects children. It can be a tough journey, but there are appropriate treatments. High-risk neuroblastoma may still be in your child's bones or bone marrow if they've had an incomplete response to their initial treatment or treatment after a relapse. Ask your care team if DANYELZA could be the next step for your family. In clinical trials, more than 1 in 3 patients responded to treatment with DANYELZA, and over 1 in 4 achieved a complete response, meaning no detectable cancer. While there can be side effects, your care team will be right there with you to keep your child as comfortable as possible. I hope you found this information helpful, and thank you for your time.
What is DANYELZA? DANYELZA is a prescription medicine used in combination with a medicine called granulocyte macrophage colony stimulating factor, GM-CSF, to treat children 1 year of age and older, and adults with high-risk neuroblastoma in the bone or bone marrow that has come back, relapsed, or that did not respond to previous treatment, refractory, and has shown a partial response, minor response, or stable disease to prior therapy. It is not known if DANYELZA is safe and effective in children younger than 1 year of age. Important safety information. What is the most important information I should know about DANYELZA? DANYELZA may cause serious side effects, including serious infusion-related reactions. DANYELZA can cause serious infusion-related reactions that require immediate medical attention. Infusion-related reactions are common with DANYELZA. Tell your healthcare provider right away if you get any signs or symptoms during or after your DANYELZA infusion, including swelling of your face, eyes, lips, mouth, or tongue, itching, redness on your face, flushing, skin rash or hives, trouble breathing, cough or wheezing, noisy, high-pitched breathing, feeling faint or dizziness, low blood pressure, nervous system problems. Talk to your healthcare provider right away if you have new symptoms or worsening of nervous system problems, including severe pain from nerves, neuropathic pain, including pain in the belly, abdomen, bone, neck, legs, or arms. Pain is common with DANYELZA and can be severe. Inflammation of the spinal cord. Signs or symptoms may include weakness in your legs or arms, bladder and bowel problems, pain in back, legs, or stomach, abdomen, numbness, tingling, burning sensation. Reversible posterior leukoencephalopathy syndrome, RPLS, also known as posterior reversible encephalopathy syndrome, PRES. PRES is a condition that affects the brain. Your healthcare provider will monitor your blood pressure and check for any neurologic symptoms after your DANYELZA infusion. Signs or symptoms of PRES may include severe headache, vision changes, changes in mental status such as confusion, disorientation, or decreased alertness, difficulty speaking, weakness in your arms or legs, seizures. numbness, tingling, or burning sensation in the arms or legs, nervous system problems of the eye. Signs or symptoms may include unequal pupil size, blurred vision, trouble focusing your eyes, larger pupil size, dilated, decreased ability to see, sensitivity to light, problems urinating or emptying your bladder, prolonged urinary retention. Do not receive DANYELZA if you have had a severe allergic reaction to naxitamab-gqgk, the active ingredient in DANYELZA. Ask your healthcare provider if you are not sure. Before receiving DANYELZA, tell your healthcare provider about all your medical conditions, including if you have high blood pressure, have heart disease, are pregnant or plan to become pregnant. DANYELZA may harm your unborn baby. Your healthcare provider will do a pregnancy test before you start treatment with DANYELZA. Females who are able to become pregnant should use effective birth control, contraception, during treatment, and for 2 months after your last dose of DANYELZA. Talk to your healthcare provider about birth control choices that may be right for you during this time. Tell your healthcare provider right away if you become pregnant or think you might be pregnant during treatment with DANYELZA, are breastfeeding or plan to breastfeed. It is not known if DANYELZA passes into your breast milk. Do not breastfeed during treatment and for 2 months after your last dose of DANYELZA. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of DANYELZA? DANYELZA may cause serious side effects, including C. What is the most important information I should know about DANYELZA? Swelling of the heart, myocarditis. Myocarditis has happened in adolescents ages 12 through 18 within days of receiving DANYELZA. Tell your healthcare provider if you get any signs or symptoms of myocarditis, including chest pain, shortness of breath, irregular heartbeat or feel like your heart is racing, high blood pressure, hypertension. High blood pressure is common in people who receive DANYELZA. Your blood pressure will be monitored during your DANYELZA infusion, and at least each day on days 1 to 8 of each DANYELZA treatment cycle. Tell your healthcare provider right away if you get any signs or symptoms of high blood pressure, including headaches, seizures, nausea or vomiting, chest pain, dizziness, visual changes, shortness of breath, feeling that your heart is pounding or racing, palpitations, nosebleeds, decreased blood pressure, orthostatic hypotension that can be severe and require hospitalization. You may feel dizzy, lightheaded, or pass out, faint when you rise too quickly from a sitting or lying position. Your healthcare provider will monitor your blood pressure before you start and during treatment with DANYELZA. The most common side effects of DANYELZA include fast heart rate, vomiting, cough, nausea, decreased white blood cell, red blood cell, and platelet counts, diarrhea, decreased appetite, tiredness, skin rashes, decreased level of potassium, sodium, and phosphate in the blood, hives, fever, headache, injection site reaction, swelling of the body or only in one part of the body, anxiety, irritability, increased liver function blood tests, decreased blood sugar level, decreased calcium levels in the blood, decreased protein levels, albumin in the blood. These are not all of the possible side effects of DANYELZA. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088.